Cognitive aids are another tool to help manage our cognitive load during a crisis. Examples of cognitive aids in medicine are using a 3D model during surgery, using a pediatric advanced life support card, and using a CPR feedback device. As we've discussed in Section 2, our working memory has a finite limit of elements it can manage at one time. In 1956, George Miller published one of the most cited papers in psychology and suggested that we typically only grasp 7 items at one time. Also known as Miller's Law, this concept explains why phone numbers are 7 digits. Remember, the mental burden of processing multiple items of information at one time is referred to as cognitive load. This cognitive load can be coupled with our own physiological response to stress. We know that an increase in heart rate is associated with deterioration in our ability to cognitively process what's going on around us. In these settings, particularly in an emergency, a cognitive aid helps your brain process and apply information more efficiently. A good cognitive aid often combines words and pictures. This combination takes advantage of dual pathways in the brain that can process information simultaneously, which helps to reduce cognitive load. This dual code theory suggests that we have separate pathways for visual information versus language entering our working memory. This means that instead of 7 items, we can now cram in more information by using both words and pictures. By using multiple senses simultaneously, information transfer is improved and our brains can function more efficiently. Cognitive aids can help us focus our attention on things we might otherwise skip or forget. By using a checklist, we may not miss that gorilla or the elephant in the room. Watch this scene from our crisis scenario of the team running through a transport checklist. This process can potentially help balance attention at a moment's notice.
Awara's ready.
Okay, let's double check our pre-transport checklist.
Sorry, what's up?
Can we run through our transport checklist, please?
Sure thing. Monitor.
Check.
Airway.
Check. Good airflow and tank level.
Lines clear and meds available?
Check. Blood and fluids on the stretcher. I have propofol and code meds just in case.
Route clear.
And receiving team and OR aware.
Good. Renan, your patient.
Let's roll. In 2004, this algorithm, unanticipated difficult tracheal intubation, during routine induction of anesthesia in an adult patient, was published by the Difficult Airway Society to manage the unanticipated difficult intubation. How would you visually improve this algorithm? Take a moment to reflect on your answers, and if it's helpful to you, consider writing them down. 11 years later, this new algorithm, Management of Unanticipated Difficult Tracheal Intubation in Adults, was published. What changed? Don't worry too much about the content. Do you find this aid easier to read? Why? Note that the title is more pronounced and that the boxes are aligned. There's only one pathway down. By making the algorithm easier to comprehend visually, it reduces cognitive load and allows the reader to focus and absorb the content more easily. A cognitive aid does not need to be a comprehensive set of instructions. In fact, too much information can limit the ability of a cognitive aid to help with the task. Here's another version of a cognitive aid for airway management that's designed to be used under high stress and acuity situations. Note its design and simplicity, and its use of both pictures and a minimal amount of words. It's important to remember that cognitive aids are not a replacement for knowledge, experience, or training. A novice who's not familiar with the science behind a medical crisis scenario will likely struggle with a checklist. Many checklists utilize boldface items for immediate action, and these boldface items are easier to retrieve from the repetitive experiences, training, and habits of experts. To summarize, A good cognitive aid can decrease our mental burden, reduce inattentional blindness by slowing our thinking down to find hidden clues, and move our teams ahead to a desired future state. Cognitive aids, however, are not a replacement for expertise.